Good evening, viewer. Welcome to our Glory Globe TV. Here's a breaking news. Yes, a Mayo Clinic study shows stem cells derived from patients' own fat are safe and many improve sensation and movement after traumatic spinal cord injuries. The findings from the phase 1 clinical trial appear in Nature Communications. The results of this early research offer insights into the potential of cell therapy for people living with spinal cord injuries and paralysis for whom options to improve function are extremely limited. In the study of 10 adults, the research team noted 7 participants demonstrated improvements based on the American Spinal Injury Association impairment scale. Improvements included increased sensation when tested with pinprick and light touch, increased strength in muscle motor groups, and recovery of voluntary anal contraction which aids in bowel function. Scale has 5 levels, ranging from complete loss of functions to normal function. The 7 participants who improved each moved up at least one level on the ASIA scale. These patients in the study had no response, meaning they did not improve but did not get worse. The study documents the safety and potential benefit of stem cells and regenerative medicine, says Mohammad Byron, MD, a Mayo Clinic neurosurgeon and first author of the study. Spinal cord injury is a complex condition. Future research may show whether stem cells in combination with other therapies could be part of a new paradigm of treatment to improve outcomes for patients. No serious adverse events were reported after stem cell treatment. The most commonly reported side effects were headache and musculoskeletal pain that resolved with over-the-counter treatment. In addition to evaluating safety, this phase 1 clinical trial had a secondary outcomes of assessing changes in motor and sensory function. The authors note that motor and sensory results are to be interpreted with caution given limits of phase 1 trials. Additional research is underway among a larger group of participants to further assess risks and benefits. The full data on the 10 patients follow a 2019 case report that highlighted the experience of the first study participant who demonstrated significant improvement in motor and sensory function. Stem cell mechanism of action not fully understood. In the multidisciplinary clinical trial, participants had spinal cord injuries from motor vehicle accidents, falls and other causes. 6 had neck injuries, 4 had back injuries. Participants ranged in age from 18 to 65. Participants' stem cells were collected by taking a small amount of fat from a 1 to 2 inch incision in the abdomen or thigh. Over 4 weeks, the cells were expanded in the laboratory to 100 million cells and then injected into the patient's lumbar spine in the lower back. Over 2 years, each study participant was evaluated in Mayo Clinic 10 times. Although it is understood that stem cells move towards areas of inflammation, in this case, the location of the spinal cord injury, the cell's mechanism of interacting with the spinal cord is not fully understood, Dr. Byron says. As a part of the study, researchers analyzed changes in participants' MRIs and cerebrospinal fluid as well as in responses to pain, pressure and other sensation. The investigators are looking for clues to identify injury processes at a cellular level and avenues for potential regeneration and healing. The spinal cord has limited ability to repair its cells or make new ones. Patients typically experience most of their recovery in the first 6 to 12 months after injuries occur. Improvement generally stops 12 to 24 months after injury. One unexpected outcome of the trial was that 2 patients with cervical spine injuries of the neck received stem cells 22 months after their injuries and improved one level on the ASIA scale after treatment. 2 of 3 patients with complete injuries of the thoracic spine, meaning they had no feeling or movement below their injury between the base of the neck and mid back, moved up to ASIA levels after treatment. Behind the report, Glory Globe TV, Delhi, Bharat.